I'm Associate Professor Gail Garvey and I'm pleased to be nominated for the Bupa Health Foundation Emerging Health Research Award.
My name is Joan Cunningham. I was Gail Garvey's PhD supervisor and I'm really pleased to be nominating her for the Bupa Health Foundation Emerging Health Researcher Award.
My research is focusing on cancer and Aboriginal and Torres Strait Islander people, and I'm doing that because it's impacted on my family and my community, and it's an important issue that requires addressing.
Cancer is the second leading cause of death. It accounts for more deaths than diabetes and kidney disease every year, but until recently, it just wasn't on people's radar. And Gail has been a key driver in changing that.
The research that I do is broadly in the area of health services research and trying to improve the systems to get better outcomes for Aboriginal and Torres Strait Islander people. So it involves looking at prevention strategies such as cancer screening and Indigenous people's participation. It requires investigating the supportive care needs and the unmet needs of Indigenous cancer patients and how that can impact on the uptake of services and continuing to engage them in services. Should I be lucky enough to win the award, it's going to keep cancer and Indigenous people high on the agenda. It's going to be another way of trying to illustrate and demonstrate to the wider community that cancer is indeed an issue that needs to be addressed.
I'm Dr. Laura Dagley. I'm a postdoctoral research fellow at the Walter and Eliza Hall Institute of Medical Research, and I'm very pleased to be nominated for the Bupa Health Foundation Emerging Health Researcher Award.
My name's Dr. Andrew Webb. I'm the laboratory head here at the Walter and Eliza Hall Institute, and I'm very proud to be nominating Laura for this award. She's a very hard-working researcher, she's very dedicated, and in this instance, she's put in an enormous amount of work that I think will potentially lead to some pretty significant outcomes for the Indigenous community of Australia.
So what we've done is look at the blood of children that are affected with acute rheumatic fever using this cutting-edge technology, and we're able to find a diagnostic signature of the disease in these Aboriginal children, and we hope that perhaps we can translate this into a diagnostic test that can be used rapidly in the clinic. There currently is no definitive test for diagnosing this disease, so if we're able to identify a more reliable way of diagnosing ARF and rheumatic heart disease, then we can prevent children that basically have the disease progress to a stage where it becomes life-threatening. The main beneficiaries of this research would be young Aboriginal children aged between 5 and 14 years old. If I were a recipient of the Bupa Health Foundation Emerging Health Researcher Award, it would provide ongoing support to help translate this diagnostic signature that we've developed into a more reliable diagnostic test that we can take out to remote parts of Australia and prove effective in these areas where it will be most helpful.
I'm Dr. Emily Reeve and I'm a research fellow with the University of Sydney and Dalhousie University in Nova Scotia, Canada.
I believe Emily's research has the capacity to make a big difference to health and quality of life for older people in Australia and internationally.
I'm really pleased to have been nominated for the Bupa Health Foundation Emerging Health Researcher Award.
The idea is that older people wind up on a lot of drugs that they accumulate through their lives, which may well have been prescribed in good faith and helped them when they were younger, but as they get older, the risk-benefit equation changes and these drugs start to cause more harm than good. And Emily's research has been about trying to work out what older people and their carers think about this and how best to stop those drugs that are causing net harm.
The work that I'm doing at the moment is actually developing deprescribing guidelines. So the first group of drugs that we're looking at are medications that are used to treat the symptoms of dementia. And we know that the use of what we call inappropriate medications can lead to things like adverse drug reactions, hospitalisations, as well as actually being a burden to the person taking the medication.
She absolutely is worthy of this award. She has both personal and professional qualities which make her an outstanding researcher.
I want to keep doing this work. So the exposure that this award would give me and the award itself would really enable me to continue doing this research.
I am Dr. Joanna Tadeusz. I am a research fellow at the Clem Jones Center for Neurobiology and Stem Cell Research at Griffith University. I have been nominated for the Bupa Health Foundation Emerging Health Research Award.
I nominated Joanna for the award because of what she did during her PhD, which was to open up a whole new area of research that we can now use to develop a therapy for spinal cord repair.
I was a marine biologist and I finished doing my PhD in neuroscience. However, I was always interested in how we can use marine organisms to actually be able to understand why some of them are able to regenerate the members and we don't.
There are 12,000 people in Australia who are currently living with spinal cord paralysis. They say that what they want is not just to be able to move their body, but also to feel their body as well. And that's something that you can't see that, but it's the restoration of feeling, so they can feel the human touch, feel their loved one holding their hand or feel the weight of the child on their lap. To be able to restore that to someone who's lost it would just be incredible.
Very simply, the aim of my research is to be able to develop a holistic therapy for a spinal cord injury. We are making the difference, and I really believe that we are just really close to find a cure. We will do it. I'm pretty sure we will find the cure.
My name's Dr. Joseph Doyle. I'm an infectious diseases physician from the Alfred Hospital, and I'm really pleased to be nominated for the Bupa Health Foundation Emerging Health Researcher Award.
This award is for someone who has had real impact for the health outcomes of all of Australians, and I think Joe really epitomises this as an individual. His research is really looking at improvements in the health outcomes and treatment delivery of a problem that impacts the whole of Australia.
My project is aiming to optimise the treatment of hepatitis C for highly vulnerable populations. 230,000 Australians live with chronic hepatitis C at the moment, and the goal overall is to try and make sure that everybody who's living with hep C can be offered treatment, and over the next decade, if we can treat everybody, we actually have the prospect of eliminating hep C as a public health problem.
This research is important because it's something that impacts all of Australians and many people overseas, and particularly impacts those who are the most vulnerable, which are often neglected. So this is crucial research in that space.
The Bupa Award would help me continue my research career and expand into new questions, because there's always questions you come across, but you don't always have the resources or the time or the capacity to try and explore them all. And certainly awards like this give you that extra bit of help to try and bring on extra pairs of hands to try and direct research as I get more independent and more productive over time, I hope.